How fortuitous! A massive measles outbreak in Texas greets anti-vax Robert F. Kennedy Jr. on his first full week as America's health secretary. What could possibly go wrong? Welcome to the No Spin Zone. Graphs Grievances starts right now. Before widespread availability of vaccines in the 1960s, measles was the single leading killer of young children globally. But 25 years ago, the highly contagious, severe airborne disease was declared eliminated from the United States, meaning no spread of disease for more than 12 months. This remarkable feat, truly remarkable, coming thanks to a highly effective vaccination program in the U.S., encouraging parents to inoculate their children against the measles virus. However, since the COVID-19 pandemic, the rate at which children are vaccinated against measles, along with polio, whooping cough, and chickenpox, has fallen. As you can see here, for the 2019 through 2020 school year, around 95% of kindergarteners were vaccinated against measles. However, by the 2023 through 2024 school year, under 93% of kindergarteners were vaccinated. And while that might not seem like a significant difference, in reality, under the 95% vaccination threshold, health experts say means people are no longer protected by herd immunity. In essence, when you get vaccinated, you are not only protecting yourself from the measles, but you are also helping protect those around you by making it very difficult for the highly contagious virus to spread. So where are Americans most susceptible to measles now? Well, it turns out that those national vaccination rates I just showed you mask far more precipitous drops in some states. Here you see the massive decline in kindergarten measles vaccination rates in Idaho, Alaska, Wisconsin, Minnesota, Florida, Colorado, Oklahoma, and on and on. These are the places contracting measles is now much more likely. And get this, there are now an estimated 280,000 kindergartners without vaccination against measles, an increase of some 100,000 children in the U.S. from before the pandemic. This dramatic decline in vaccination leading to hospitalization and life-threatening complications for those who get measles. According to the Centers for Disease Control and Prevention, nearly 3 of every 1,000 children in the U.S. who becomes infected with measles will die. And about 1 in 5 unvaccinated people in the U.S. who gets measles is hospitalized. Remember, all of this is preventable and was not happening just 25 years ago in America, when many more parents were choosing to responsibly vaccinate their children. So why are vaccination rates falling in the U.S.? While there are undoubtedly many reasons for this decline, including medical, philosophical, and religious, shifts in vaccine rates almost perfectly fall along political lines. In every state Donald Trump won in November, with the exception of West Virginia, the share of kindergarteners with a vaccine exemption increased, while in the vast majority of the states that supported Vice President Kamala Harris, vaccination exemption rates stayed relatively flat or fell, meaning more children were getting vaccinated. Similarly, according to Gallup, 63% of Democrats and Democratic leaners say childhood vaccinations are extremely important, compared to just 26% of their Republican counterparts. And even more scary, 31% of Republicans say vaccines are more dangerous than the disease they were designed to protect, compared to just 5% of Democrats saying the same. And all of this terrible news comes as the United States Senate just voted to confirm arguably the biggest anti-vaccine conspiracy theorist, Robert F. Kennedy Jr., to be the nation's health secretary. Despite President Donald Trump's pick repeatedly disparaging vaccines, falsely linking them to autism, and making a living undermining public health, every Republican senator, with the exception of Mitch McConnell, endorsing Kennedy to lead America's $1.6 trillion Department of Health and Human Services. And what do you know, just as Kennedy is settling into his new office, the deep red state of Texas is experiencing a rapidly growing measles outbreak. Health officials now reporting the number of measles cases has increased to 58 in the South Plains, up from just 48 cases at the end of last week. 15 of those cases are in children under the age of 5, and an additional 33 cases are in children between the ages of 5 and 17. So far, 13 individuals have been hospitalized, with officials reporting that most of the infected people are unvaccinated or only partially vaccinated. And who knows where this will go, but it certainly does not look good, as Gaines County, where the outbreak is centered, has an extremely low vaccination rate. Health officials suspect that anywhere between an additional 200 to 300 people are currently infected with measles, but remain untested. Once again, all of this is preventable with a safe, simple vaccine that has been shown to be 97% effective. But because Kennedy and people like him have preyed on desperate people for years, falsely blaming vaccines for a seemingly endless list of ills, people, primarily children, are now suffering and may die. Are Kennedy and Trump going to console parents when that happens in their name? Thank you for watching Graf's Grievances. Let me know what you think. Please like, subscribe, share, and join me tomorrow for more.